Hello and Assalamu alaikum, everyone. Welcome to the Medical Briefs. So let us revise one MCQ in which we can also revise some basic concepts for rheumatology. Fine. So this is a 27-year-old man. He is seen by the GP with polyarticular pain. He describes lower back, hip, finger pain and stiffness, which improves with movement throughout the day. Now, it means that this man has got inflammatory pain in his back and hands. The pain, which has stiffness and which improves with the movement, is usually the inflammatory pain. Okay, so this man is having some inflammatory pain in his back and hands. Now, he also has a history of Achilles tendonitis, pain in the back of the feet. Fine. On examination, his second and third finger digits are swollen and warm to touch maximally over the distal interphalangeal joints bilaterally. Fine. There seems to be symmetrical involvement. Okay, fine. His second digit on the left finger, left hand, is entirely swollen and inflamed despite no preceding trauma or evidence of infection. Fine. What is the most likely diagnosis? The options given are ankylosing spondylitis, enteropathic arthritis, psoriatic arthritis, reactive arthritis, and rheumatoid arthritis. Well, if you read the MCQ carefully, you'll find they mentioned this man has distal interphalangeal joint involvement mostly. We can exclude rheumatoid arthritis because rheumatoid arthritis will give you proximal involvement. It will involve the metacarpophalangeal joints. Okay, though it also gives you symmetrical polyarthritis, but it will usually involve the proximal joints, the metacarpophalangeal joints. So we can exclude option E. Other options A, B, C, D, they are known as seronegative spondyloarthropathies, and they share some common features. If you read the MCQ again, you'll find they have given you history of Achilles tendonitis and backache, which means sacroiliitis. These two things can happen in all of these four. Okay, so don't get confused. Option A, ankylosing spondylitis usually does not involve the hands and the fingers. We can exclude it. Option B, enteropathic arthritis comes with the background of long-standing diarrhea with blood, most likely ulcerative colitis or Crohn's disease or inflammatory bowel disease simply. But they have mentioned clearly that there's no preceding history of infection. So option B is also excluded. Option D, the reactive arthritis. In these cases, patients will give you history of preceding infection, bloody diarrhea, about 2 weeks prior to getting these reactive arthritis. Okay, they can have STI, UTI, or sometimes even flu-like symptoms 2 weeks prior to getting sacroiliitis or other features of seronegative spondyloarthropathies. So option D is also excluded because they have mentioned there has been no infection. So my dear colleagues, it was psoriatic arthritis, which presents as distal interphalangeal joint polyarthritis, dactylitis, sacroiliitis, and Achilles tendonitis. Please remember, sometimes the typical psoriatic skin rash and the nail changes commonly associated with psoriasis may appear later, and the joint pain may appear earlier than actually the rash. So this was psoriatic arthritis. I hope you enjoyed the explanation. Please like, subscribe, and share our channel, The Medical Brief. Thank you very much for joining.